My LPA is greater than 240, which means that my risk of having a heart attack or a stroke is greater than 99% of the population. And with being a pharmacist, I know that there isn't any medication that is fully effective at lowering this. However, I am at the gym, and there is one thing that I can do to lower my risk of having these complications in the future. So I'll show you now. Along with no medication, there's also no diet or no exercise regime that will also lower LPA. But like I said, you've got to go and try and reduce all the other factors with regards to your risk. And this is just a push day because this is the first time I've joined the gym really in 3 years. I've been able to push a bit more weight in a safe environment, but that is one of the big things, is trying to build and increase the amount of muscle mass that you have. And the reason being is that it reduces the risk of insulin resistance. It allows your body to then greater utilise the energy there. And if you improve all the other aspects, which is improving the arterial health, improving energy utilisation, then it does reduce the chance of you having any complications when it comes to cardiovascular disease. And I think I'll come on to this later on in the video, but the process of having a heart attack in the first place is a build-up of plaque. And the ways to do that, or the ways to improve that, are by improved blood flow. And one of the best ways, as we all know, is to do exercise. Now, it's not just strictly weight training. I've just focused on this today, but you can do general zone 2 training, or you can do high intensity interval training. But for me, I just find that my bread and butter is weight training, so this is where I get the most enjoyment, and this is where I'm going to be the most consistent. Now, in this workout, I haven't talked about what I've actually been doing. I'll wait for this woman to eventually go past. That's one thing. I'm not that confident yet to just whip out a camera in the gym. But with these workouts, I just focus on warming up each muscle group and then going to 3 sets where I'm pushing myself to about 8 reps, where it is going to be quite a hard effort, and then try and do as many exercises as I can, give or take in 45 minutes. That's reasonable for the majority of people out there. Now, LPA is fully expressed between the ages of 2 and 5, and given the fact that your levels don't change that much throughout the entirety of your life, once you have them measured once, they're not going to be changing that much at this moment in time because there's no treatment available. So what is the point of getting it checked if you can't really adapt or manipulate them levels? And it's like I said earlier, the process of heart attacks and strokes is, well, the main is atherosclerosis, basically where there's a build-up of plaque within the arteries, and that leads to an inflammatory cascade which then blocks the flow of blood to whatever part of the body that we're discussing, heart or the brain when it comes to stroke. So if you can reduce other factors that will lead to that plaque buildup, so in this case, if we can reduce the overall levels of ApoB, which is what we can do in LDL and non-HDL cholesterol, if we can lower the levels of insulin resistance and inflammation in general, then we can then offset that risk. Now for me, mine is greater than 240. I still need to get mine calibrated because if it's 400, then there's a good chance I could have one in the next 10 to 15 years. Obviously it's all risk, but given my family history, everyone has had a heart attack on the male side before the age of 50, or a stroke even by the age of 55. And given the fact I've got diabetes, it was one of them things, did I want to find out my LPA, or did I want to look into not having it tested and see if I can manipulate other forms of my lifestyle? But I got it tested and mine ended up being in the top 1%. And when you hear stuff like percentiles, it means, so in this case, I was in the 99th percentile, meaning 99% of the population have a better result than I did or do. And going forward with LPA, there is some good evidence on the horizon when it comes to treatment. So there's meant to be these things called antisense oligonucleotides, which are in clinical trials. People who are on pharmacological agents for lipid modification, such as PCSK9 inhibitors, they do have a 30% effectiveness. However, they are not fully going to reduce the levels. And sadly for people like me at this moment in time, heart disease is still on the horizon. But going forward with these videos, I'm changing the format. I keep saying this every video, to be honest, but I want to discuss a topic at the beginning, go and show what I'm doing from a non-pharmacological point of view. So the gym in this case, where I've done muscle building, and I would have discussed in the voiceover, and then go through why that's important at the end of it. So just a bit of physiology to finish on. LPA is something that the body makes that attaches to cholesterol molecules, and when you attach it to it, I'll try and insert a picture, it basically makes it more sticky and more prone to clog and trap within the arteries. The best analogy would be if you've got a normal wheel and you have snow chains on it. That is essentially what LPA is. It's the snow chain, so it's able to trap a lot more molecules in it. It can trap more inflammatory mediators, and then when that's going into the artery and getting stuck, it's then more prone to trigger this inflammatory cascade. But it is something that we do not test in the NHS. Very rarely do I see patients in my clinic go off to specialist clinics and get this blood test. And as I've put out numerous times, it's affecting about 20% of people. And out of the people I've personally tested through my private blood testing, I think at least three people have come up as really high LPA levels, which we wouldn't have thought would have been the case in them because they're generally healthy on the surface. They don't have any past medical history or family history. And I would advise everyone to get at least once in their life, get it tested, because like I said, it's got a lifetime value. But as always, if you got this far, thanks for watching. This is not medical advice, it's informational purposes only. More of my stuff now is focusing on metabolic health and heart health because that's where my passion lies and that's where I have a lot of clinical and personal experience in. And if you've got any subjects below, any comments, by all means leave them, and I will see you in the next one. Thanks for watching.